I've heard about this ADHD thing, but I've never really known anything about it. So I decided to do some research on the subject.
I thought I'd start by just asking around at the local park. What does ADHD stand for?
Boy, now I can't remember.
I'm not really sure.
Good question. I should know that.
I actually have no idea. I know it's attention deficit something.
I think it's attention deficit something.
Attention deficit disorder or something like that.
Well, I know the AD is attention deficit and D is disorder. I don't know what the H is.
Do you know what ADHD is?
Well, it's a problem that some young kids have, and adults too, I think.
You can't focus on what's most important at the time. You get easily distracted by shiny objects.
It's very in trend right now. Like a lot of kids nowadays have that disease, and sometimes like doctors give a lot of medication for that.
People who can't sit still long enough to learn something.
I think it's a condition where people have trouble focusing for long periods of time.
Fidgety or maybe anxious.
The nerve endings don't operate, or the nerve synapses don't work like they're supposed to.
It is a neurobiological condition that disrupts the processing of information in the brain. Contrary to popular belief, ADHD is not caused by poor upbringing. It is a congenital disorder that requires timely treatment.
The exact cause of ADHD is unknown, but there are 3 factors related to its occurrence. They are heredity. Children with a parent with ADD or ADHD have an increased chance of getting ADD or ADHD too. A neurobiological disorder in the brain that is caused by chemical imbalances inside the brain with neurotransmitters. And environmental influences. ADHD seems to be more commonly diagnosed nowadays because society generally is ADHD unfriendly.
Symptoms of ADHD include difficulty sustaining attention, hyperactivity, and impulsive behavior. ADHD affects several global and specific mental functions, including intellectual function, impulse control, sustaining and shifting attention, memory, control of psychomotor functions, emotion regulation, higher level cognition, including organization, time management, cognitive flexibility, insight, judgment, and problem solving, and sequencing complex movements. The DSM definition of ADHD includes 3 presentations: the predominantly inattentive type, the hyperactive impulsive type, and the combined type. Changes to the DSM-5 for the diagnosis of ADHD raised the age and requirements of diagnosis. Symptoms can now occur by the age of 12 rather than by the age of 6, and several symptoms must be present in more than one setting. New descriptions were added to show what symptoms might look like at older ages, and for adults and adolescents aged 17 or older, only 5 symptoms are needed instead of the 6 needed for younger children.
So I want to get a sense of how ADD affects you. So you have ADD?
Yes.
You know you got it?
Yes.
Okay. How can you tell?
Well, when I get frustrated, I get overly frustrated sometimes. When I can't do my work, I shut down too easily, and I sometimes just have problems overall working and just keeping my anger under control.
Sometimes it's harder for me to read and pay attention in class.
Okay. And is that true at home too, or when you're trying to do homework? Or?
Yeah, trying to do homework is kind of tough too.
I can't all sit straight, like sit there for a while and not fidget, and I can't concentrate for a long time. And I can get distracted easily.
Teachers can use modifications to ensure students are retaining the information and are comfortable in their environment. Seat the student in a quiet area. Seat the student near a good role model. Seat the student near a study buddy. Increase distance between desks. Increase immediacy of rewards and consequences. Praise compliant behavior. Provide immediate feedback. Ask for parental help in encouraging organization. Provide organization rules. Encourage student to have a notebook with dividers and folders for work. Send positive notes home. Make time to talk alone with the student. Allow extra time to complete assigned work. Provide reassurance and encouragement. And allow the student to stand at times while working.
Let me ask you about, do you know what stress is? When you
Yes.
feel stressed, pressured, or tense?
I have a lot. I always have a lot.
A lot of stress?
Yeah.
Okay. Tell me about that. When do you feel stressed? How do you feel stressed?
It's mostly when I'm doing homework. Like I said, when I do something wrong, I could say I'm a lean, mean stress machine.
There are numerous social implications for children with ADHD. The child appears unfocused and has difficulty directing his attention during social activities, thus missing important parts of peer interaction. His poor attention and concentration prevents him from focusing on how peers behave during games or sports activities. Many children with ADHD find it hard to understand or otherwise misinterpret the emotions of others. The child may also show inappropriate or excessive behavior when compared to his peers. Any behavior that appears childish or disruptive could be irritating to the child's peers and thus lead to teasing and social rejection. Unfortunately, social isolation has a negative impact on a child's self-worth and self-esteem. Low self-esteem during childhood years is a direct cause of problems that arise in adult peer relationships. Poor impulse control is also a large contributor in instances of social isolation of children with attention deficit hyperactivity disorder. Children with ADHD experience difficulty in stopping or adjusting behavior, often getting carried away. Finally, the inability to adjust behavior traits such as bossiness, aggression, and reduced empathy during social activities may result in the negative feelings among other children. Modifications to the social climate include encouraging social interactions with classmates if the student appears withdrawn or shy. Set up social behavior goals with the student and implement a reward program. Create small groups of 3 or 4 students according to the student's interests and preferences, which encourages him to cooperate and develop friendships. This promotes social interaction, utilization of social skills, cooperation, and is an outlet to learn appropriate behavior and control impulsivity. Set the student up with a study buddy who has good social awareness and enjoys being helpful. And identify the targeted social skills and have the student practice prior to the activity and process after the completion of the activity. Students with ADHD can exhibit a range of behaviors from mild to severe. Mild behaviors include calling out and engaging in attention-getting behaviors. Some moderate to severe behaviors include negativity, defiance, hostility, destruction of property, aggression, theft, lying, and violations of societal norms and/or rules. Steps the educator can take to modify the behaviors of students with ADHD include creating a behavior contract with the student. If a student is easily frustrated, praise and acknowledge appropriate behavior and good work frequently. Some students with ADHD may require visual cues such as stickers or charts to monitor positive behaviors. If a student is unclear about appropriate social behaviors, create goals and utilize a reward program. If a student displays antisocial behaviors, encourage cooperative learning tasks and praise positive social behaviors. Suggest and undertake school-based psychology and training programs. Encourage the students' help-seeking behaviors. Utilize psychosocial interventions and screening of those students considered at risk for self-injurious behaviors. Utilize psychosocial skill training for students in order to decrease suicidal ideation. Utilize whole group or whole school approaches to change the ethos of a school with regard to psychological well-being. The educator should create an environment where mental health issues can be addressed without the student feeling the stigma from his peers.